Hey guys, welcome back to my channel. I'm Dr. Lada if you're new here, and if you're an oldie but goodie, hey girl. We are going to talk about what's it really like to be a nurse. I am going to just kind of give you guys advice, and I'm also going to tell you about my own personal experience. So if you're interested, stay with me. I have lots of experience as a nurse. Many of you guys already know that I worked as a cashier at Burger King for about 6 years, and then when I decided to change my life, I decided to go into nursing. Let me fix my shirt. So entering the profession, I started school for the LPN. I started the LPN program, and before going into that program, I had absolutely zero experience in healthcare. I did not know how to take blood pressures. I did not know how to make a bed the way they like for it to be made when you're in a hospital. So I went in with no experience. So for those of you who are contemplating a career in nursing, you don't have to have experience. That is what school is for. So what kind of things do nurses do? As nurses, we do assessments on our patients. So you will listen to the lungs, you will do an abdominal assessment to check for bowel sounds, ask the patient questions about their bowel movements, their urinary output. You will change dressings, you will administer medication, you will collaborate with other team members on the patient. You may give report to the physical therapist before they start their session. You may talk to the speech therapist about how well the patient is doing. So as a nurse, assessment skills are extremely important, and you will learn these skills in school. And as you gain experience as a nurse, your assessment skills will improve. So I know it'll be rocky when you first start, and you'll feel like you don't know what you're doing, but with time you'll get it. The first year is challenging. Prepare for growth. Prepare for good times and bad times. Just be prepared to be in a vulnerable position, because as a new nurse, as a new anything, it's challenging, right? You are learning, you are growing. It's really important at this time, your first year, to surround yourself with people who want to see you win, people who want to see you grow, and they want to see you succeed. So, kind of finding and attaching yourself to those kind of people in the workplace will definitely be beneficial for you in the long run. The first 9 years of my career as an LPN, and then a couple of years into the LPN, I got my RN, or my associate's degree. I worked on a skilled rehab unit, and I learned a lot on that unit. What did I do? As a licensed practical nurse, I administered medication. I did assessments on my patients. I collaborated with other members of the healthcare team. I collaborated with other nurses. Now, this is my personal opinion, but bathing patients or cleaning them up if they have an accident and you happen to be in the room, nurses do that too. I have also worked on a respiratory unit, but that was short-lived, because the one thing that makes me queasy is just sputum. I can tolerate it and I can do it if I have to, but just doing it day in and day out, dealing with like trachs and people who needed to be suctioned often, I couldn't do it every day. So the respiratory unit was short-lived. I think I was only there for a few months after I got my ASN. So yeah, so I loved working on the nursing rehab unit. I did a cardiac unit for a short period of time. I worked on a spinal cord injury unit for almost 5 years. And then after that, I transitioned to advanced practice nursing, and I've been doing outpatient nursing as a nurse practitioner for the last, it'll be 7 years this year. So yeah. Yeah. Oh, wow. That's awesome. So, again, you know, if we just run through some of the things that nurses do, just so you guys can know, well, what do nurses really do? As a bedside nurse, you would be responsible for assessments, patient assessments. So doing vital signs, you know, listening to the lung sounds, listening to the bowel sounds, doing the skin assessments. You would also administer medication, oral, transdermal, dressing changes. You may have to do it more than once in a shift, but dressing changes are part of nursing. I think they're so interesting. I actually really like to do dressing changes, but I will say that if you're really busy, I don't know, it can get a little overwhelming if you have meds that are due and someone's dressing needs to be changed. So you need to be able to multitask because, and prioritize your time, because you will be doing lots of different things at one time. Let's see. Oh, and you'll also transfer patients, pull patients up in bed, and sometimes they're heavier than you, so you have to get help, you know, and you have to do it properly so as to prevent injuring yourself or hurting your back. There is a lot of lifting depending on what type of unit you're on. So if you're on med surge, or definitely if you're on a rehabilitation unit, there's a lot of lifting and transfers. For me, on the spinal cord injury unit, lots of lifting and transfers, lots of up and down, because these patients did not just stay in bed. They had to go to physical therapy, speech therapy, occupational therapy. So we were getting them up and down and ready for therapy multiple times a day. So that is a part of our job description. And I will say that with the transfers, yes, the certified nursing, the CNA does a lot of the transfers, but a lot of times they need your help as a nurse. A lot of times you may walk into the room, there's the nursing assistant struggling to turn the patient or struggling to transfer the patient. And, for me, it was just second nature to drop my books or whatever I had and go over and, assist. So knowing how to do those things, knowing how to transfer safely, knowing how to, turn a patient. Those are all things that, we do as nurses. Over time, you will develop a nurse's intuition. I have always had this, and this was after I had a lot of experience as a nurse, the ability to just know when something was not right with one of my patients. And my intuition has never failed me. Now, it's not only intuition, but it's intuition coupled with skills. So you develop that with time. One of the things that I love the most about nursing is the scheduling. You can work day shift, you can work evenings, you can work nights, you can work 8 hours, you can work 12, you can work 6. So for me, it's always been the 12 hours. If I'm there, I'm there. I feel like do 3 12s and be done, and you'll have 4 days off a week. Some people have changed their minds about nursing because they're nervous about giving injections, they're nervous about body fluids, they're nervous about like blood, they're nervous about having to clean someone up when they've had an accident. Those things have just become second nature for me. Look at things in terms of not like ew, but more like this is a body function, and I have been trained to take care of this. If you feel like, wow, I don't know if this is going to bother me, I don't know if seeing body fluids or blood or giving someone an injection or changing a dressing or different smells of those things are going to affect me and make me hate my job, you know, maybe you should shadow a nurse for a couple of days to see, you know, but eventually after you've done things so many times, you just kind of get used to it. Choose a place to work that you like and you do something as far as nursing that you like. So whether that be like OBGYN clinic or working at the bedside in a rehab facility, or maybe you love respiratory, doing that, you know, just making sure that you pick something that you don't mind doing, that you will like, because if you don't like it, then you're just gonna hate going to work every day. And you know, that is torture. So financially, nursing is sweet. You can make a lot of money being a nurse. You can make a lot of money being a nurse practitioner. So if you're just wondering like, okay, but you know, is the pay good? It is. And you know, it seems like there's always jobs for nurses. So if you want to choose something and just know that you're going to be able to get employment after you graduate, then nursing is definitely the way to go. Just keep in mind that as a nurse, the intuition, the skills, that is all good. That's all fine and dandy, but you also need to have the heart. You need to have the heart, meaning you have to have a love for people. You have to like to take care of people. You have to like people to like this job, because you are dealing with people all the time, every day, and they're not always in the best mood because they don't feel well most of the time. So that's something to keep in mind. Your why. Why are you doing this? Why are you going to nursing school? You just have to have the right reason in order to have or in order to be happy with your career choice once you graduate and you're actually doing the job. So that's food for thought. That's something to think about. Another thing I love about nursing is just all of the different things you can do in this field. It doesn't have to just be bedside. So what can you do? You can work at the bedside. You can work in case management. You can do home visits. You can work in an outpatient clinic. You can work as with an attorney on different cases and give a nurse's perspective. The possibilities are just limitless. And that is what I love about nursing. That you don't have to stay in this spot. You can move around if you want to. You can go back to school and keep moving up the ladder. I also want you guys to be realistic when it comes to nursing and social media. Nursing is a wonderful career. It's great. It's, you know, I've done this for 21 years. But sometimes it can be glamorized a little bit, like on social media. And I'm not saying that people do that intentionally, because nursing is awesome. It is awesome. But I just want you guys to remember that we are dealing with people and saving lives, and you're dealing with sick people, you're dealing with you have someone's life in your hands. It's also the other side of burnout. Let's just keep in mind that it's a serious career, so you have to know what you're doing. And just a tip for those of you who are in school: things change when you think of it in terms of studying for a test versus studying to save somebody's life one day, right? That really makes you want to make sure that it sticks, whatever you're learning, that it sticks. Thank you guys for tuning in today. I had so much fun creating this video. Thumbs up if you like this video and you'd like to see more. And I'll see you guys in the next one. Love you.